So good evening, everyone. Thank you all for joining our MBBS Pathway webinar, which is actually conducted by Lyceum Placements. I'm Tharendra, so I will be your panel speaker who will be taking you through the entire process of basically guiding you as to how you should, what you should actually get when it comes to your academic requirements and then basic requirements that you need to get to actually become a doctor, and also running you through the entire process of after completing your university program as to how to get your ERPM licensing and then your clinical internship and all of that information. Apart from myself, Mr. Arun, my colleague, will also be joining in today to give you all a little bit details about the entrance exams, which are normally needed for certain universities if you go abroad. So hope all of y'all can see my slides. So basically, I'll just run y'all through the academic entry pathways when it comes to the medicine program. So of course, you get the direct entry requirements, the direct entry qualifications rather. So normally, when it comes to the medicine pathway, we are looking at the local GCA advanced levels or the edXL Cambridge. Sometimes some people think when you're going abroad, when you have done a local qualification such as our Sri Lankan national exams, it can come in as a disadvantage, but there is no such thing like that. Because when it comes to all the universities, they pretty much recognize any type of curriculum which is offered by any country. So you need to keep in mind that there is nothing for you all to worry about following any particular curriculum at your school. So when it comes to local examinations or edXL, Cambridge, there are certain scores that normally that all of you all have to take. So most of the time when it comes to the medicine pathway, we are looking at something like triple A or maybe A star when it comes to edXL or Cambridge, or 3 A's when it comes to the local curriculum. But keep in mind, this will depend on the country or this will depend on the university that y'all are going to. So it doesn't necessarily mean that it is always 3 A's. So I will be basically taking y'all through the entry requirements for each and every university. I won't be able to tell you each and every university's requirement, but I should be able to give you somewhat of an idea as to what you all should be aiming for when it comes to your future exams. And then, yes, so we always have a set of students who don't really want to take the A-level pathway and they want to take all the alternative routes, such as the foundation routes. So some of the most recognized foundation routes when it comes to the medicine path, before the medicine pathway, is normally the Monash University Foundation here, which is also known as Muffy. So when we talk, we say Muffy. So I will be referring to the Monash University Foundation here when I use that term. And again, now one of the other foundation routes, which is kind of picking up traction nowadays, is the OSST exam. This is a Canadian curriculum. So it's the Ontario Secondary School Diploma. So if you do that, again, if you get like basic, there is like each, like I said before, each and every university has a particular mark. So if you achieve that particular mark for this foundation, so when it comes to Muffy, certain universities want 90%, 95%. Then again, when it comes to the OSSD as well, there are relevant marks like that. So if you all achieve that, then you all are able to get into the medicine program. But keep in mind, there is something called the Sri Lankan Medical Council, which is very important when it comes to the medical medicine pathway. Why I'm saying that is, if you all are actually going to a when you're going through the medicine pathway, it is mandatory that you actually check whether you all are going for a Sri Lankan Medical Council recognized university. So let's say you decide to go with a Sri Lanka SLMC recognized university, then there is nothing for you all to worry about, because technically speaking, once you complete your examination, you can come back to Sri Lanka, write the ERPM. It's going to be the standard route, which I will run you all through later. But there are non-SLMC recognized universities as well. So now when you all are taking the foundation route, the SLMC has clearly mentioned that even if you all are taking the foundation route, that it is mandatory that you all have still sat for A levels. So when they mean sitting for A levels, of course, they are not requiring you to get 3 A's or anything as such. The SLMC has a designated A level requirement, a minimum A level requirement that you have to normally meet if you all are taking the foundation route. So that is usually when it comes to the local curriculum, it is 2C's and a S. And if you all are going with EdXL or Cambridge rather, then it's going to be CCD. But keep in mind, the EdXL curriculum and the Cambridge curriculum, I think you all know, we have something called the AS and the A2. So make sure that you all are, now when it comes to the local curriculum, of course, let's say a student sits for it once and they get 2C's and maybe he or she fails the third subject, right? So if we are repeating it in the Sri Lankan context, you have to repeat all three in order to get into the university. But that's not really the case when it comes to the EdXL or the Cambridge. You are able to take separate subjects. Let's say you got 2C's and you got an E. So then you are able to take that subject that you got an E for separately. But when it comes to medicine, you need to make sure that you all can't take up subjects in isolation. So if you all are repeating, you all have to repeat all of them together. If you all are repeating one AS module, you need to make sure that all the papers that you set for AS are completed and not just that particular subject that you actually lost marks in. Okay. And when it comes to the SLMC subject requirements, you have to make sure, because when it comes to the Sri Lankan context, if you're going for a national university, a state university, you have to have completed biology, chemistry, and physics, right? So it is mandatory when you are going abroad through the foundation route or the direct entry, whatever, that you have completed biology, chemistry, and physics. Now, certain universities normally take maths as an alternative for physics, but if you want to come back to Sri Lanka and sit for the ERPM exams and move forward in your career, then it is absolutely crucial that you take biology, chemistry, and physics. So moving on to the medical career map when it comes to medicine, of course, like I said before, the main thing is that you achieve your academic entry. So, okay, when it comes to academic entry, there are a couple of things that universities look at. Your A level requirement, or you can take your foundation as well. But keep in mind, like I said before, A levels is also mandatory. You are supposed to get the mandatory minimum requirement. But apart from this academic entry, there are also other exams, interviews, English proficiency tests that you all have to complete when it comes to getting into a university. Now, in a Sri Lankan context, I think all of you all know, if you all ace your A levels, if you all get 3 A's, if you all get a good ISAT score, you are pretty much guaranteed entry into the medicine program, the MBBS program. But that is not really the case when it comes to the foreign context. Most of the universities have an interview which you are supposed to pass, because that will also bear a certain weightage when it comes to the selection process. Then you all need to have done IELTS, and then also entrance exam. So you get various entrance exams, which I will run by a little later towards our slides. Then one, of course, when it comes to the medical degrees, most of the medical degrees out there are usually 5 to 6 years. This, again, the duration depends on the country of the university. Now, if you take the Australian context, you get 5 year programs as well as 6 year. But if you take the Malaysian concept, it's mostly 5 year programs that we see. But then again, a lot of students are placing interest. A lot of students and parents are placing interest when it comes to countries like China, Belarus, Georgia. So most of those programs are a 6 year MBBS program, right? So once you complete your medical degree, then of course it comes to the licensing. So sometimes we have certain questions being asked, okay, if you go for an SLMC recognized university, are you still supposed to sit for the ERPM exam? Yes, the answer is yes. You are supposed to sit. If you don't go for an SLMC recognized program, then what happens is you are not eligible to sit for the CRPM exam. So that is the only difference. So make sure that you, as a university guidance counselor, I of course always tell all the students out there, go for an SNMC recognized program, because certain countries have restrictions when it comes to taking clinical placements, even though you have studied in that particular country. So it's always safe to go for an SLMC recognized program. So by any chance, if there is any restriction, you can always come back to your home country and do the licensing exams. Then again, for the full registration in the Sri Lankan context, you have to complete a 1-year clinical internship to receive your permanent practicing license in Sri Lanka. So moving on, when it comes to some of the key points that I think all the students or even parents should actually note when it comes to the Sorry about that. I believe we had a small technical glitch. So when it comes to the key points, I think the parents and students should always know is listed down here. So I will run you all through each and every item so that you all get a clear idea as to what you all should be prepared for, what are the obstacles will be coming your way, how you all should basically improve your profile so that when you all are applying to a university, you have all that sound information and the necessary guidance to do the needful. So keep in mind, when it comes to the universities, most of the universities have a non-refundable fee that will apply to the universities. Okay, so let's say your application sometimes gets maybe not selected or it is rejected for some reason. This will be a non-refundable fee. Okay, so keep in mind, not all universities have an application fee, just a few. Okay, and then when it comes to age requirements, now if you take certain countries, especially Malaysia, they have an age restriction such as 18. You have to be 18 if you are taking the medicine program. Okay. Now, some parents are under the view that this is, different from university to university in Malaysia. No, that is not really the case. When it comes to Malaysia, it is a government rule brought in by the Malaysian Medical Council that you have to be 18 to pursue a medical degree. Okay. So just like that, different countries have their own restrictions. So if you all are applying, you all need to make sure that you all actually know what are the age requirements, what are the academic entry requirements, things like that when you're preparing for the program. Then early preparation. Now, most of the time, I think one of the main issues that we have is sometimes students wait till, if it's like, especially the local curriculum students, it's very difficult for us to know when the exam results are being released. Okay, so there is a little bit of a disadvantage when it comes to the national curriculum students. The reason is we are not able to apply until the results come out. So normally when it comes to the medicine program, there's always only, most of the countries tend to have only one intake. Especially the Western countries tend to have only one intake. So if your results come after the intake, or maybe there is not enough time for you to process your visa application, then you are at a little bit of a disadvantage. But when it comes to the Edexcel or the Cambridge students, it's pretty much very easy because there's something called, I think most of you all must be aware, but your school is able to provide something called the predicted results. Right. So normally early preparation means there are given deadlines. So normally some of the universities don't actually wait till your A-level results for them to close the application deadlines. Their application deadlines are somewhere around June, July, right? So because of that, now normally when it comes to the Edexcel and the Cambridge curriculum, we all know that your results are coming on August 12th, August 14th, right? So you all need to make sure that if you all are applying for a university in maybe, let's say, UK or Aussie, or even certain Malaysian universities that y'all actually meet some sort of a counselor 1 year in advance and get that relevant details when it comes to application deadlines. What are the things that you need to have completed when you're lodging the application, so that y'all don't really miss out on the opportunities available out there. Okay. So like I mentioned before as well about the SLMC recognition. So I mentioned why it is important. It is important because certain countries have restrictions when it comes to taking clinical internships. So if y'all don't have that opportunity, y'all can always come back to Sri Lanka and do the ERPM license exams, and then get on to your clinical internships. Okay, so y'all need to make sure when y'all go so when you go to the SLMC or the Sri Lanka Medical Council webpage, y'all are able to see what are the universities which are recognized by SLMC, right? And what are the universities which are not. They have listed down all the universities which have been recognized by them up until today, but there is also the expiry date as well. They have told you all as to when they have basically mentioned the period that the SLMC is recognizing that qualification. So sometimes it could be from 2020 to 2025. So anybody who's joining after 2025, they have given the very specific date as well. They will be like 2025 September 19th, 13th, or whatever. So any student who's joining a program after that particular date will not be having that. They have to deem that university as them not having that SLMC recognition. Okay. So always make sure that the expiry the recognition period has not lapsed, so that it's good for y'all. And that, when y'all come back, y'all don't have to worry about, your university not being recognized or anything. Now, lot of students nowadays, I'm not too sure whether everybody is familiar with this term called gap year. But when it comes to the US curriculum or when it comes to the UK curriculum, a lot of students tend to take a gap year. Okay. Even though I mentioned UK and US, doesn't mean that the Australian students or the Malaysian students don't take it. There's nothing as such. But normally, when it comes to the UK and the US context, the university begins in September. So when your results come out in August, you technically have a 1 year gap. That is what I meant there. But when it comes to the Malaysian countries or the Australia or Malaysia, sometimes certain students also want to take gap years. So what is this gap year, and what are you going to do during this gap year is absolutely critical when it comes to a student who wants to take on a medicine program, right? So normally a gap year is you take without immediately going in to your higher studies at a university. You'd sort of take like a short period, like a break, where you kind of, do things in order to build your profile. Okay. So especially students students who want to pursue medicine, we would like to encourage them to take things like, relevant studies. I mean, it doesn't have to be medicine related, but they can take on maybe some sort of an IT program or whatever, because technically speaking, IT is also taking over the world. And sometimes having that IT tech knowledge is quite crucial nowadays. So you can take up certain studies. Then you all can do something called doctor shadowing or first aid programs. Now, how these things can come into help in a medical career pathway, what I would say is things like doctor shadowing, they build your confidence. They give you the clinical exposure, and also they kind of, you are able to see crisis management, because technically speaking, when you're shadowing a doctor, you will be in a hospital setup, right? So you all will be in a realistic hospital setup where, everyday patient to doctor lives are taking place. So you are exposed to first-hand communication between doctors and patients, and y'all are able to see sometimes, because we have certain students who think they want to become a doctor, but once they shadow doctors and they see the pressure and everything, sometimes they realize, no, this is not what they actually like. They don't really have they don't really have the passion that they thought they were having. So these are type of things that you are able to sort of understand by taking things like doctor shadowing. Then first aid programs. Again, these are very short programs. These are not going on for months long or anything like that. But these are absolutely critical because things like first aid programs, you are able to build on, you're able to kind of build that resilience, or you are able to handle pressure. You're kind of you are able to keep calm and handle a situation. Then also you are prepared for emergencies. Then what happens is, let's say you are actually having a patient or whatever, and you have to conduct CPR, right? Or the airway is obstructed. So these are a couple of things that through the first aid programs that y'all will be learning. So these are added things that y'all can do. Sometimes, I mean, you all don't need to take a gap year per se. Now, if you take the edXL, all the Cambridge students, your exams have already done. They finished in June. So you all have a little bit of time up until August, right? So these are things that you all can take up so that you all don't necessarily have to take a gap year, but you all still are sound with that knowledge, right? Then I have listed extracurricular activities. Most of y'all might wonder, okay, what does extracurricular activities actually have to do with, like, a medicine career path? I understand what the whole confusion is about, because when it comes to a local, or if you're, let's say, y'all are going for a local university, then y'all don't have to take up any of these things, because it's purely based on academic requirements, right? The scores that you, basically the grades that you score for your exams. But things like sports, club activities, they build on a lot of skills, transferable skills, I would say, when it comes to a medicine career. You all might wonder, okay, how is that possible? For example, now if we take things like sports and everything, or we can take music, I'll just take sports as an example. When you're doing sports, something that the very critical transferable skills that you all will be developing would be discipline, then teamwork, then resilience, right? When it comes to discipline, even I mean, certain sports, it requires you to get up at a certain time, dedicate yourself into that particular sport. If you want to, I mean, if you want to be well, I mean, of course, all of y'all, when y'all are becoming doctor, you want to be great at what you do, right? Because at the end of the day, y'all are handling some person's mother, father, or a relatively important someone to a particular person. Okay, so you all have to be good. So through sports and everything, you build on that dedication of committing yourself to that particular sport. So those are type of things that you all need to build in yourself. Okay, then again, when it comes to team working, so in a theater, you are not basically acting in isolation. You all will be having, when it comes to a particular surgery, there will be different types of doctors in different specialities who will be present in that room. So I mean, it can be, these can be very delicate procedures, right? So how all of you all come together and basically aim for the success of a good surgical, I mean, basically, for the operation to be a success, you need to have good teamwork and leadership skills. Then also resilience, and how you take pressure under certain situations. Now, especially when it comes to sports, I mean, I think it's something that, I mean, there is also research backing this thing up as well, where, certain athletes and everything, how they are able to sustain very well under high pressure. So when y'all are in the operating theater and everything, I mean, there's a lot of pressure, right? Because at the end of the day, the life of the patient who's lying on the bed is resting upon your hands. So how you actually manage through that stress is quite key. So these are little things that you'll learn from sports. And even when it comes to music, I mean, especially things like, let's say you are performing to an audience. That's pretty much like performing a surgery, right? So it's a lot of pressure when you all have to go and perform to an audience. Then again, when it comes to, let's say, it's a particular music instrument, your hand precision, the steadiness of your hand matters. So I mean, y'all might think, okay, these are not really important, but the transferable skills that y'all gain from these things are pretty much very important. And again, moving on, university transfers. Most of the students think that it is possible for you all to transfer from university to university. Technically speaking, at the end of the day, it lies at the university's discretion to be able to transfer. Keep in mind programs like nursing, medicine, psychology. Most of these programs are quota-based programs. So by quota, what I mean is there's a dedicated number that they take when it comes to students for a particular program. So if you take medicine, most of the medicine programs, they take students from they take 60 to 80 students when it comes to international context, right? So you need to make sure that if you all are transferring, I mean, there should be a proper reason, okay? I mean, even if you have a proper reason, doesn't mean that the university will grant, because like I've mentioned on the slide, it's completely at the discretion of the university. It is very, it can be quite, I mean, sometimes the university might take it as a negative, from a negative perspective as well, because it's a quota-based program, right? Let's say you're transferring from one university to another, you are basically taking that opportunity from one student who was able to join to the primary university that you all had engaged first. So you all have taken away that chance, and now you all are transferring to another university. And even when it comes to the university that you're transferring, if they have taken up, I mean, all the places available for the students, then technically speaking, you don't have a place to transfer. Okay. So it is not something that we would advise you to do. But again, it's up to you all and the university to decide. Then when it comes to accommodation, most of the time, medicine students, I would of course recommend, we would of course recommend from Lyceum placements to always go with on-campus accommodation. Not because of anything, because on-campus accommodation, like the name states itself, it is based inside the campus, or most of the time it is relatively close to your university lecture halls per se, right? So then what happens is medicine students tend to have very extensive and very intensive schedules, and you all have a lot of reading hours, clinical hours, this and that, right? So it's always very easy when you all are based near the campus. Of course, I mean, it's a known thing, on campus accommodation tends to be a little bit more expensive than off campus accommodation. But what we would always recommend is on campus. Now, this is something that you'll need to you'll need to make sure that you'll kind of start looking at very early on rather than waiting till your results come, because the reason is once the results come, everybody starts looking for accommodation because they know, okay, the last hurdle has, they have passed the last hurdle of getting that, meeting that entry requirement. So they're all looking for accommodation. The sad truth is most of the on-campus accommodation is already sold out by them. So if you're 100% sure that you are able to get in, I would suggest don't wait till the last minute, because there is a massive waiting list when it comes to certain on-campus accommodation. Make your deposit payments and get them in line. Then when it comes to medical scholarships, it is absolutely important to know that all of these scholarships are based on your academic achievement. It is nothing to do with extracurricular activities or anything when it comes to the medicine programs, okay? But again, the scholarships are only available in certain universities, and most of the universities do not provide scholarships usually. Then when it comes to the internship status, so some of the parents are under the impression that if you study at a particular university, it is guaranteed from them to, it is guaranteed upon completion that you will be getting the clinical internship. That is not really the case. That is why I highlighted on going to an SLMC recognized university at the very outset itself, so that you all don't have to worry. If you all don't get the opportunity to join a clinical internship in the country that you all are studying, you all always have a backup option. And keep in mind, when it comes to career paths, sometimes students actually think, okay, if you study medicine, that you have to become a doctor. There is no such thing like that, right? Sometimes we get students, I think I personally handled a case of a doctor. When I handled the student, the mother was actually telling me that, they had a problem when it comes to seeing blood and everything. So then what she decided was she didn't want to practice as a doctor, but she went into the administrative side of doctoring, right? So there are so many things which are available. You don't have to practice per se. So you can get into research and academia, or you can join World Health Organizations or any type of government health organization, because you all can get into policy making and everything, or you all can get into the pharmaceutical companies or the biotech companies, because they also, I mean, as doctors, you all will be heavily, you all will have that knowledge when it comes to the physiological side. You all will have updated information about how to handle patients, what are patients actually looking at, what are when it comes to drugs and everything that you administer to patients, what are actually good drugs, what are the ways that some of the patients, what are when it comes to especially cancer patients and everything, what can be corrected, or what are better ways of producing drugs and everything. You can get into these roles. So it's not really it's not just the doctor career which is available. There are other career paths as well by studying medicine. Then one of the other important factors is the personal statement and interview. Keep in mind, I think I told it before as well, certain universities have interviews. And it is absolutely key that you all have taken up things like, I'm not telling you all to take gap years or anything as such. That's not what I'm saying. But um, doctor shadowing, or like I said, first aid programs, then taking up extracurricular activities. These are things that you all will be questioned on at the interview, right? So it is always good that you all have taken up these things, so that if you all are being compared with a student, because like I said before, the interview is also graded. There's a certain percentage coming in from the interview as well. So then you all are able to, let's say it's a student, you're being compared to a student who has amazing, excellent academic results, but who has not really done anything else apart from the academic studies. So then you have a better chance of standing out, right? So that is why we are telling you all to, take up on certain things, because it will help you develop social skills. I've listed out compassion, problem solving, adaptability, self-awareness. All of these social skills will be developed. And then again, when it comes to personal statements, not all universities require personal statements, but most of the UK and the Australian universities wants to know what type of individual you are, okay, before the interview. So once they read the personal statement, only they decide, okay, are we giving a chance to the student for an interview and, the latter stages. So when it comes to the personal statement, they would ask you who you are. Okay. And then they would ask questions such as, some important things that has happened they will give you like a particular duration, and they would tell you, list down certain important things and why you consider those situations to be important when it comes to your life. Then they would ask you how you see yourself in about 5-10 years in a medicine career. And who sometimes they will ask you, apart from your parents, apart from your guardians, who are the people who have made an impact in your life, and what was their contribution to who you are today. And then also they will ask you how basically they will ask you why you think you are a better candidate for a medicine program. So then you need to list down points as to why you think you are suitable enough to take on a career such as medicine. So moving on, so here you go. I mean, I was talking about Malaysia, Australia, UK. So we'll start off with Malaysia. So this is just to give you a little bit of context as to how the Malaysian MBBS programs are structured and how it is. So like I've mentioned over here, intakes are multiple, but keep in mind, normally if you all are going for medicine Malaysia, and if it's a Malaysian university, then you pretty much get multiple intakes all year around. But let's say, I mean, you get so many universities based in Malaysia, which are from sometimes from the UK or maybe Australia. So then those type of universities will only have the particular intake that is available in that respected country. Okay, so if you take, I mean, one of the famous universities that students go for medicine in Malaysia is Monash University. So I mean, you can see this table on the side. So when it comes to Monash, Australia, we only have one intake, which is February, because it's an Australian-based university based in Malaysia. Australian university based in Malaysia. Again, you can see the intake is Feb. Now, if you go one below, I've put MSU, IMU, Manipal, Quest, Lincoln. Now, all of these universities are Malaysian universities. So you can see they have more than one intake present during the year. So the tuition fee, what I've ranged here, I have put it as 63,000 to 138,000, 138,720 ringgits per year. Keep in mind, this is just an idea for you to get as to what your tuition fee will cost. So if you go to a university like Lincoln, then your average tuition fee will be about 63,000. Keep in mind the figures that I have put here are for the 2026 intake. 2027 results have not yet been released. So this is just for you to get an idea as to what the cost will look like. So it's a 5-year program. Most of the Malaysian universities are a 5-year program. So each year is not going to be 60. If let's say you're going to Lincoln, it's not going to be 63,000 each and every year. Your fee will increase little by little. And if you are, I've again listed down 11.5 million for the tuition fee. This is for Monash. You have to understand that Monash is an Australian university and it is ranked 31 in the world. When it comes to the QS World Ranking 2027. So that is why it is expensive. Then the accreditation that you, if you go for a medicine program in Malaysia, all the programs are accredited and recognized by the Malaysia Medical Council. But let's say you go to Monash University, Malaysia, keep in mind, it is also recognized by the Australian Medical Council. So technically speaking, after you complete your Monash University, your medicine program in Monash, Malaysia, if you go to Australia, you don't have to do the AMC examinations. There is nothing for you to do because it's an Australian qualification that you have studied. Okay. So the minimum age requirement, I told this at the outset as well. You have to be 18 years. It is a mandatory requirement given by the Malaysia Medical Council. So universities can't change. So if there is anybody telling you otherwise, please make sure you don't take that advice and that you actually query that with the university so that you know you are 100% sure. So when it comes to the A-level entry requirements, Monash University Malaysia tends to be a little bit on the higher end. We need at least 2 A's and a B to get into the Monash program. And apart from the A-level entry requirements, Monash also requires you to have sat IELTS. If you have done, you have to have sat for ISAT, which is an entrance exam, which Mr. Arun will run through. And then you need to have sat for an interview. These are called multiple mini interviews. Again, I will touch on them later towards the latter part of the slides. And then lastly, IELTS. So some of the parents are under the view if you do EdXL or Cambridge, you don't have to sit for IELTS. Yes, that is correct. But keep in mind, again, this is at the discretion of the university. So Monash, of course, if you have done EdXL or Cambridge, English or English language literature, and then you all have gotten a B pass or a C pass for that particular subject, then you all are pretty much exempted from doing IELTS. But certain universities such as IMU and all, you are required to take IELTS. But if you're a student who has done the national curriculum, it is mandatory that you sit for IELTS and get those scores. And normally for programs such as medicine, the IELTS requirement is pretty high. So make sure that you all check the relevant website, get that information, or you can reach out to us. I will be passing our contact details at the end. You all can ask us, okay, what is the minimum entry requirements? What are the IELTS, the individual bands and the overall scores that you need to score, and we will be giving you that information. Keep in mind, I would say one of the main questions that students ask us when it comes to Malaysia is, are you able to work in that country? No, part-time work is prohibited by the Malaysian government. You are able to work during certain festive seasons and everything, but then again you need to make a payment and then get into that whole system. It's a very lengthy process to get that work permit or whatever over there, and it doesn't make sense because it's not something like you can, like in other countries you're able to work 20 hours, 24 hours, but that's not really the case. You are only able to work during certain periods in Malaysia. Okay, and then again post-study work. After you complete your medicine program in Malaysia, you are not eligible for any years of work rights in Malaysia. You are supposed to return back to your home country. So I think I've given you a lot of details about Malaysia. Keep in mind, one of the most important factors is the programs that I've listed down over here. And apart from this, there's a university called MASA. All of these universities are recognized by the Sri Lanka Medical Council. So if you go to one of these universities, because like I mentioned before, internships are not it's not possible to do your internships in Malaysia, so you have to return back to your home country. So that is why the SLMC recognition is quite important, because then you can come for your clinical internships back to Sri Lanka. Then I have put an asterisk for the International Medical University, or IMU rather. So when it comes to IMU, transfer options are available. Now, even though Monash University is an Australian-based university, you need to understand that transfers are not possible when it comes to Monash University Malaysia to Monash University Australia. But if you're looking for something like a pathway program, studying a couple of years in Malaysia and going for going to Australia or UK, then IMU is one of the universities that you can consider, because they have partner medical schools that they have partnered with, like the name says, and you are able to go. But keep in mind that this is not guaranteed, because the entire batch will have about 200 to 300 students, right? So like I said before, the medicine program is a quota based program, so each and every university has given a certain quota to IMU. So a lot of students will be competing for these places. So you need to always keep in mind that this is not a guaranteed transfer. You just have the option available, and if you actually get the necessary scores and everything, you are able to transfer. One more mandatory thing, if you all are transferring, it's that particular country's cost that you all will have to pay, and not the Malaysian tuition fee. Then when it comes to medicine in Australia, it's very standard. There is only one intake for all the universities, and none of these universities are recognized by the SLMC. And tuition is very expensive when compared to Malaysia. We are looking at 16.8 million, at least minimum, for 1 year. This is just the tuition fee. This does not touch on accommodation. So 16.8 million, it's a 5-year program. So it's a hefty investment that you all will be doing. And again, because it's an Australian program, all the universities are Australian, they're all registered with the Australia Medical Council. Now, when it comes to age requirements, there is no minimum age per se when it comes to Australia's. Each university has their own. So what we've seen is certain universities will take you from 17 years as well. Okay. And in Australia, if you study there for more than 2 years now, your program is anyway going to be 5 years or 6 years now. So then you're eligible to work 2 years after that. And yes, you get your part-time work rights as well. So you're able to study 24 hours per week or 48 hours per fortnight. But this is not something that we would recommend usually for medicine students because the schedules are pretty intensive. So it's going to be quite difficult. When it comes to additional entry requirements and everything, yes, I mentioned there are entrance exams such as ISAT and UCAT. ISAT is predominantly, if you're going for an Australian university, you need to have sat for ISAT or UCAT ANZ. UCAT ANZ is also a test just like ISAT, but what I would suggest is for you to sit for something called, for you to sit for ISAT because it is pretty much accepted by all the universities, whereas UCAT ANZ is only accepted by certain universities. Um, you can only sit for this once a year. So if all universities, it's not just about sitting this exam, it's also about meeting the minimum mark. So various universities, I mean, it's out of 200, so you're supposed to score. Universities have their own entries. So some would say 175, some would say 160. So you have to know what is the ISAT score, and then you have to sit for it. So you can only take it once a year. So if you basically fail to meet that entry requirement, you can't go for the medicine intake. You have to basically wait for the next cycle. Like I mentioned over here, it's two sections that they're questioning you on: your critical reasoning and your quantitative. So basically, your logical reasoning, then how you analyze situations and come about decisions based on evidence is what they're actually checking. It's nothing to do with subject knowledge. They're not going to test you on chemistry, biology, physics. No, they basically give you situational. It's sort of like a situational judgment exam where they give you certain situations and you're supposed to analyze them and come into particular reasonings. So medicine in the UK, again, it is the September intake. And again, just like Australia, it's very expensive. It's a 5-year program, and we are looking at least 17 million plus just for the tuition fee. The accreditation is through the General Medical Council, and the minimum age when it comes to the UK programs are 17 to 18 years. Post-study work options are also available. So since January 2026 onwards, you're able to work 18 months. It was 2 years before, but now they have brought it down to 1.5 years. And again, you're able to work the 20 hours per week. Keep in mind, when it comes to the medicine programs, you all have a special deadline. So normally for all the universities in the UK, you have to use a portal called the UCAS, right? So through this UCAS portal only you will be submitting your application. So Lyceum Placements is a UCAS agent. So if you all are looking at medicine programs to be applied for the UK, you can definitely get in touch with us so that we are able to guide you through. So if you all are going for the next year September program, your deadline will be this year October. So soon as your results come out in August, get in touch, because it's not just about getting your academic entry requirements. No, you have to get recommendation letters. Your referees need to provide certain recommendation letters into the system. So there's a lot of things, and you all need to write personal statements. So each university will have their own requirements. So it's a lot of work that you all need to put in. So you all need to get in touch with us. So when it comes to the UCAS portal, yes, there is an application fee. It's 34 pounds and 50 pence. And then when it comes to the medicine in the UK, like I mentioned ISAT and UCAT ANZ for Australia, there is an exam called UCAT that you need to sit for when it comes to the UK. Now, these days, the UCAT registrations have opened. It opened on 20th May, I believe. So you're able to register for a certain duration, and then the exams will start. Keep in mind, if the registration date lapses, you all are not able to register. And because it's a mandatory thing when it comes to your medicine application, you all won't be able to go for that intake. So make sure that you all meet the you all register for this exam in advance and get your scores in line. So yes, so speaking about the additional entry requirements, which I told that I will be talking about. So when it comes to interviews, these are called multiple mini interviews. So when it comes to the UK, Australia, we have these MMI interviews. So these are basically they test you on advocacy, collaboration, critical thinking, empathy, ethical reasoning, then your motivation, your resilience. These are type of things that they test you on. So these are small stations. So these six things are basically questioned from you. So they take about 5 to 10 minutes each on discussing these personal attributes that I just mentioned to you all. So it is not about, because most of the students think, okay, they basically ask you about the subject knowledge. No, they have judged you about your subject knowledge through your academic grades. So now they want to know a lot about you. What are about your personal attributes that you're bringing into the table, right? So they will be giving you, they will be judging you on all of these things. Then they will give you certain things, like they will give you, I think they're called ethical dilemmas. Basically, they will give you certain situations where there are role plays, and they ask you certain, I mean, like I've said over here, the station types are basically including ethical dilemmas, role plays, reflective personal questions, and policy healthcare analysis, right? So sometimes what they do is they put you they give you a certain situation, and all answers seem right, yes, but there is one particular answer for each and every question, right? But it is how you actually approach that answer that they actually kind of analyze you on. So these are things that we will also be, preparing you all for. The co-assessment, evaluators basically look at your communication skills, your ability to empathize, your logical reasoning when it comes to things, your professional judgment when it comes to certain situations. All of those things we will be guiding you as to how to prepare yourself for these multiple mini interviews, right? So that's basically the outline when it comes to the medicine programs. But I would also like to take a little bit of time to sort of run you all through the financial visa requirements, financial requirements when it comes to visas. When it comes to Malaysia, it's pretty much very easy. There are no financial requirements that you need to have when it comes to Malaysia. So it's very easy. They won't be looking at your parents' income. They won't be looking at the liquidated funds that you have in your bank accounts. But unfortunately, if you're looking at countries like Australia or the UK, then yes, liquid funds is what they're looking at. They're not looking at the properties that you all have. They're looking at, like I said, liquid funds. So I mentioned before as well, the tuition fee when it comes to a medicine program varies from 16 million upwards, right, when it comes to the UK and Australia. So then, apart from that, you need to also show your living expenses. Now, living expenses in Australia it was around 5.5 million, but because of the exchange rate depreciation, like the Sri Lankan rupee depreciation and all, it has risen to about 7 million during the past 2 months. So so you need to show your first year tuition fee, then the living expenses, and the return airfare. Return airfare is usually $2,000. So when it comes to London, if you're going for, when it comes to the UK, if you're going for a London university, then your living expenses are going to be a little bit more higher. You can see on the slides, I mentioned it as £13,761, right? So you need to show this much along with your tuition fee and along with your return airfare of £2,000. If you're going for an outer London university, of course, the living expenses will be slightly more reduced. It will be 10,539. Okay. So unfortunately, when it comes to Australia and UK, the visa officers would also want to know what your parents' monthly income is about. Okay, so this can be employment income, this can be business income, this can be rent income. This can be anything, but I mean, of course, there are certain sources which are not accepted. So, like, I mean, of course, get in touch with us. Know what are the approved monthly incomes that the visa officers are accepting, so that you all know, okay, how much your parents need to have in order to support. Because normally the show money concept is for 1 year. You're showing your 1 year tuition, 1 year living, and your return airfare. So they just want to get an idea as to how you're going to be funding your second year onwards, because it's a 5 year program, right? So they want to get an idea as to how you're going to be funding your second, third, fourth, fifth years. So how they do that is through the liquidated funds which are available in your bank accounts along with your monthly income. So normally when it comes to sponsors, parents are considered as the primary or the main sponsors. When it comes to the UK, it is only parents who can sponsor you. Your aunt, uncle, your grandparents, your sisters can't come into the picture. However, when it comes to Australia, Australia is a little bit more flexible, where they allow, apart from the parents, your grandparents, your maternal, paternal aunts also to come into the picture along with your siblings. Keep in mind, funds have to be maintained in the bank accounts for a minimum period of 6 months, ideally. But with the recent, the visa outcomes and everything which are placed, the recent visa outcomes which Sri Lanka has received when it comes to students who are who are looking to go abroad for their higher studies. What we would advise is, rather than keeping it for the minimum period that they are looking for, which is 6 months, we would, of course, recommend you all to have it at least for a minimum period of 12 months, so that it places more weightage and your funds are more stronger. But when it comes to the UK, there is no such requirement of showing 6 to 12 months. 28 days is quite sufficient for you to show. I'm actually approaching my last couple of slides. So before I get Mr. Arun to come and actually give you all a little bit of information about ISAT, I also want you all to know that there is a graduate entry pathway for medicine as well. So sometimes we get students who don't really meet the entry requirement to get into the medicine program. You don't have to worry. You all are able to sometimes take up a Bachelor of Nursing or a Bachelor of Biomedical Sciences and pursue the medicine career. What happens is, it's going to be a lot of investment when it comes to your studies, because you need to complete the medicine program and the biomedical sciences program, which is about 3 years. Then after you complete your program, if you meet the necessary entry requirement to get into the grad entry medicine program, then you're lucky. But it's always easy if you're going, let's say you're going from University A, and the grad entry, you're pursuing nursing at University A, then it's always easy if the grad entry route is available in University A itself for medicine. Because if you're going to another university, they will always give preference or priority rather to their own students first, who come from the who come for the grad entry. And then if they have more spaces left, they will be looking at the other university students. So what I would always say is, if you don't have if you really want to pursue medicine, then you can take this route. But keep in mind, your duration of the entire curriculum will pretty much be extended to about 7 years. So I only spoke about Belarus, UK, Malaysia, Australia, UK, when it comes to our presentation. But of course, we are also doing university placements to Belarus, Georgia, and China via a partner. So if you all want more information, because those type of universities also accommodate A-level entry from 2Cs and a D or 2Cs and a S. So you don't have to get really high results. Y'all can get in touch with us if y'all are looking at those countries. And also keep in mind, there are alternative career paths when it comes to the science field. It's not only medicine which is available. You get nursing, biomedical. I mean, I've listed down so many career paths, so many degree programs that you can pursue, which also have a really good pay. I mean, if you actually take, nurses are being paid more than doctors for about good 10 to 15 years, and then only the doctors are able to actually pass a nurse's salary when it comes to certain countries, even though it's not really the case when it comes to Sri Lanka. Pharmaceutical industries, pharmacology, pharmacists, their pays are really good in other countries. Nutrition and dietetics are picking up. I mean, there's a lot of obesity in the world, so these things are really picking up traction. Physiotherapy, psychology. These are also alternative routes that y'all can look at if y'all are in the science field. It's not necessarily medicine which is out there. So lastly, what I would like to say is all our services are free of charge. So basically, we guide you all through the entire process. I think I've given a lot of information during this presentation. We will be taking we will be guiding you. We will be submitting your university application. We will be helping you through your accommodation. And most importantly, we will be doing your visa application for you as well. All of this will be provided free of charge. So if there is anything that you all would like to know, you can always get in touch with us early on, because like I said, you need to prep at least 1 year ahead. Ideally speaking, maybe right after your A's level, or maybe when you're preparing for A's, or when it comes to the national students, the moment you go into your A-level studies just after O-levels, get in touch with a guidance counselor such as myself and get that important information, because every year all of this information keeps changing, right? They get updated. So whatever I might say today might not really be valid in a couple of months. So you need to make sure that you all are updated when it comes to certain fields like medicine, because it is key. So yes, right now, I mean, before we approach the last slide, I would actually like to invite Mr. Arun. He is basically the ISAT coach who is at Lyceum Placements, and he will guide you through the way ISAT is structured and how it is delivered, so that you all are able to get somewhat of an idea as to what this ISAT entrance exam is all about. Mr. Arun, over to you.
Hi, Tarindra, am I clearly visible and audible?
Yes, Mr. Arun, you are.
Okay. Right. So as Miss Tarindra said, she at one point mentioned that uh, they look at your sports and co-curricular activities to see whether you will perform well in a surgery, operation theater, where you are under high pressure and your quick thinking is required and decision making is required. So yes, your certificate will say that you have sports and co-curricular activities, but how will they practically test you? Now, among the applicants, there might be a lot of candidates who have similar results to you. Maybe a lot of 3As are there. So when there are many candidates, ISAT is the tool that they use to judge which ones are the best. Why do they want to do that? Let's say after becoming a doctor, mistakes can be very costly. So they want their products, their students, to be as mistake-free as possible when they go onto the field. Now, as Ms. Tarindra said, you don't need to study for an ISAT exam. There's no studying or revision. As you would have seen in the slide, it's about quantitative reasoning and logical thinking, meaning to face ISAT, you most probably have the knowledge already. If you have sat for O-levels and if you are going through A-levels, if you have completed A-levels, you have that knowledge already. But having said that, how would you train for that? So this is how you do it. When you register for ISAT, you get practice papers there. And when you look at those practice papers, the first thing you do is, usually what the student does is they panic. They go through the paper. They don't, most of them, they say that they don't understand the questions. But my advice to them is, as Mr. Tarinder said, 3 hours, 100 questions. So if you break it down, if the target time is 2 minutes per question, first what you do is you take the practice paper that you purchased and you try it on your own. You time your questions at 2 minutes per question. And then after finishing those 3 hours, you try to see which questions that you answered easily and which questions you were not able to. Then you take the questions that you are not able to, and then you take your own time. There's no time limit. And then you take your own time and try to answer it. And then you'll be having two results again. So the questions that you couldn't answer before with the timing of 2 minutes, now so some questions you are able to answer after taking time, some you can't. This is where I come in, or an ISAT supporter comes in. Now, Ms. Tarendra used the word ISAT coach, but if you really think about it, there's no coaching here, but it's support. Now, your problem is out of the 100 questions or the questions you tried out in your paper, the questions that you are not able to answer even after spending ample time. So, as the ISAT coach or the ISAT supporter, I will be opening your eyes to see the bends and the parts that you were not able to see earlier. Then you will realize that you had the knowledge to answer the questions anyway, but you were not uh, um, seeing through the right paths or along the bends. So after that, when those two papers are done, you will realize that you had the ability to answer those papers anyway. So now you would ask me, okay, now after the support, if I get the paper, if I am able to answer the paper, how will I go and answer the ISAT paper again? Because when I timed and did it, I was not able to do it. So when I took time, I was able to do it. So what guarantee can you give me when I go there that I will be able to do it? Meaning you have to practice more and more with more and more sample papers that we will be able to give you. And then again, you repeat the same cycle. Do it with timing, and then do it with unlimited time, and then you come back for support. So this is the cycle which works until you get really confident. Now, with the knowledge you have, this is like training your muscle memory. At that point, when you answer in the paper, your mind will tell you, right, you saw a similar question when you were practicing, and this is what you did. And that is how you approach this. So you need not to worry. Only thing is you have to train. And this is one sort of exam that, you can't cram or study 2 days before the exam and go for it. You have to train your uh, brain muscles and you have to train your system. You need to bring it to your muscle memory. I will finish with one small example. Now, in an interview, a leading cricketer, I heard him say he's one of the most prominent cricketers, probably the best in our generation. The interviewer asked him, okay, now how are you so good at it? How do you score runs more than the others? What's the secret? Then he said, I stand at the wicket and the bowler comes running at me. And my thinking, my voluntary thinking stops when the bowler comes up to the crease and just about to release the ball. And after the ball is released, I don't know what happens. Somehow I score the runs. Meaning he has practiced so hard that he doesn't have to think much. The whole system takes up and plays the shot. Meaning practice makes perfect. So this is exactly how you should face the ISAT exam. To sum it up, you have to practice more and more questions. You already have the knowledge to do it. The only thing that is required is to store enough experience in your mind and develop your muscle memory so that during the actual exam, your mind, your brain will do the job for you by recalling your collected experiences that you had during the practice papers, and you will score well. Ms. Tarindra?
Thank you, Mr. Arun. So yes, I think Mr. Arun was also able to give you all somewhat of an idea as to how ISAT is basically structured. I think a lot of students, because they don't have that information, so keep in mind, yes, I think I used a rather different word, coaching, but yes, it's not really about coaching. It's about how you attempt a question, and how Mr. Arun will be able to provide that support for you. Okay. Actually, I was not able to touch on one little aspect. I think a couple of questions came to us regarding the Canada and the US pathways when it comes to medicine. Keep in mind, Canada and USA does not have a direct entry medicine pathway like Aussie, UK, or Malaysia. You're supposed to complete a normal bachelor's program first, which is normally sometimes you can do a bachelor of biomedical sciences or nursing or whatever, or sometimes certain universities have programs named as pre-med courses. So you need to take that pre-med course and then get into the medicine pathway. The pre-med course itself is 4 years, because in Canada and the USA, normally a bachelor's program is ideally a 4-year program. Okay, so then after you complete your bachelor's, that's when you get into the medical schools in the US. So technically speaking, when it comes to costs, it's very expensive, because I mean you have already paid for about 4 years of study, and Canada and USA does not come in very cheap. So apart from the 4 years, then you have to commit to about another 5 to 7 years of studies in the medical school. And also, a couple of questions came in when it comes to the New Zealand pathway as well. So New Zealand, you have to always complete a HSFY, a Health Sciences Foundation Year program. And the tricky part about New Zealand is sometimes they only take a very small crowd from the international students. So certain universities, they have openly mentioned they only take about 5 students. So because of that context, I would say New Zealand is a bit tricky. And if you all want to go into New Zealand or something, maybe it's better for you all to look at a country like Australia. Or y'all are looking at more affordable options, then we can look at Malaysia. And I think one of the other questions that had come in as well was, let me look at, if y'all have any questions, I mean, I'm open to taking questions right now. Um, I'm open to be taking questions now. So if y'all have any, y'all can list it down. Y'all can put it in the chat. So we have one question which says, could you please elaborate a little more on the path of joining a biotech company? Technically speaking, what I meant by, I mean, after pursuing a career in medicine, if you're joining a biotech company, a lot of biotech companies always have that little, gap between the actual people who are developing the utensils or the instruments which are needed for the medical examinations or the medical procedures. So sometimes when you have physicians and medical graduates with that laboratory science and the real, world patient care experience and everything, it is very it is that knowledge that you bring in when you're joining a biotech company is quite important. So y'all don't have, that's why I said y'all don't have to go into becoming a doctor per se, but maybe after you get the clinical internship exposure and everything, because when you're actually studying for your medicine program, also you will be going into hospitals, because back in the day y'all start, I mean, clinical internships and everything were sorry, not in I mean the what you call clinical hours that are provided by a medicine program was normally available towards the latter part of the medical degree. But nowadays most of the universities are incorporating clinical hours into the very outset itself. So you start, some universities basically start from the second or the third year now without waiting till the last year. So that exposure that you get itself will be very helpful if you're joining a biotech company. But let's say you are not looking at, but let's say that you all are not looking at, let's say that you all are not looking at a medicine pathway. You all want to, go on the biotech stream itself. Then what I would advise is you take up a bachelor's degree in biotechnology. Sometimes even doing a biochemistry degree program can be pretty much very helpful in going into the biotechnology field. I hope I answered your question. HMP Kahawata. If you all have any questions that you all have, please feel free to drop it on the chat, because then I should be able to see it and respond to it accordingly. Or else y'all, I'm not too sure whether y'all are able to unmute yourself, but if y'all want to take it up by unmuting as well and asking a question, that's also fine. So another person is asking, if we do take up a GEM program with after bachelor's in biomedical science, then how would it affect the SLMC registration? So again, I believe you're talking about the UK context. There's a little bit of an issue there because UK universities are currently at the moment not recognized by the SLMC. So technically speaking, you all won't be able to get the registration. I mean, you all won't be able to sit for the ERPM exams and then get into the licensing pathway when it comes to Sri Lanka. Miss Imanta, I hope I clarified that question. Is there any more? I think those are the only questions that I have received up until now. Any other questions? Okay, seems like that's about it. But yes, I think y'all can all see my slide. So basically, y'all can always reach out to us via our hotline. The number is, y'all can take like maybe a photo of it, 077 444 3355. So my name is Tarindra. If y'all want specifically to get in touch with me, yes, I'm happy to help you. Or else Lyceum Placements also have similar career guidance counselors. Y'all can get in touch with us and get that basic information so that y'all are readily prepared for your studies or maybe your child's future education. I hope this session was insightful. Thank you all for taking part, and I hope I was able to answer all the questions. But if I wasn't, or maybe if you all were not able to post your questions, again, we are available on this hotline. You can speak to us on WhatsApp, or you can directly call us, or you can even use our website and place a direct website inquiry as well. Again, thank you so much for participating, and hope all of you all have a good night.